You're listening to Conversations with AIDS.gov. We sat down with two representatives from the Coalition for a National AIDS Strategy. The following are highlights from that conversation.
My name is Chris Collins, and I'm Vice President for Public Policy at AMFAR in Washington, D.C.
I'm David Monar. I'm Vice President at AIDS Foundation of Chicago.
Thanks for sitting down and talking with us. You both work with the Coalition for a National AIDS Strategy, and the National HIV/AIDS Strategy has just been released by the administration. Could you tell our viewers a little bit about the Coalition and the work that led up to the release of the strategy?
Yeah, the Coalition for National AIDS Strategy started in 2007 as a group of organizations that came together around this kind of singular but powerful idea, simple and powerful idea, that the United States should have a singular, outcomes-oriented plan of action against AIDS, that it brings together all of the agencies and efforts of the federal government towards singular national goals. And we're excited that that campaign has come to fruition with President Obama's release of the National AIDS Strategy.
And one of the things that's important to remember is that, we're very proud and thankful that the President has come out with a strategy, and it's also important to remember that the movement for it grew out of the community. And I think a lot of that was people at the community level who do this work every day realize that we've got to harness the resources both in the federal government, but at state and local, and in the community in a more effective, sometimes targeted way, and get all of our work much more oriented around accomplishing particular outcomes. And I think the President has outlined three main outcomes for his strategies, and I think they're absolutely the right ones: bringing down infection, increasing care access and care outcomes, and reducing health disparities. If we can do a much better job of focusing on those, keeping our eyes on the prize, both as community folks and in the government, I think we can have a more effective response.
For persons living with HIV/AIDS, their friends, their family, for those of us working in the HIV/AIDS community, how and why is the strategy important to all of us?
And for folks that are in the fight, the plan is really a powerful statement about where we are right now in the fight against HIV/AIDS, and so reading it and consulting it is important. I think that groups will find that the strategy gives really some great information and some great citations that they'll be able to use locally and in their proposals for funding to talk about where we're at and what has to happen. And the strategy really calls for greater coordination of effort across the field.
So now we have a national strategy, we have a plan. What do you see as the Coalition's next steps moving forward?
The Coalition has counted on the support of hundreds of organizations across the country that have endorsed this idea of a national AIDS plan, and thousands of individuals. So we're really excited that there's a plan, but this effort was never actually about a plan. It was about getting better results in the fight against AIDS. So now that there is a plan, our focus is shifting to implementing that plan and saying that the federal government, with cooperation from states and local governments, community-based organizations, and private stakeholders, can realize the vision of the strategy, which is calling for reductions in infections, more people with HIV accessing care, and reductions in HIV-related health disparities. So now the hard work really begins. We have to make sure that we take this plan and move it forward and actually achieve these results.
The other thing I want to say too is that for all the work that everyone's put into this strategy, including a great job by the Office of National AIDS Policy at the White House and a lot of people in the community and across the federal government, the easy part is now over, and now we get to the harder part, which is implementation. One of the things that's going to be hard is that, what the strategy tells us is business as usual is not what this is about. We've got to assess our efforts, we've got to hold them accountable for results, we've got to use resources not in the way that is politically expedient always, but what is most targeted to get the job done. And I think that's going to challenge every single one of us to think about how our work is having a real impact. In the end, if we can really keep our eyes on the goals the President has set, I think that's something that that vision can really lead us to a more effective response.
Where can our viewers go to learn more about the Coalition for a National AIDS Strategy?
You can go to www.nationalaidstrategy.org.
We're soon going to be posting all of the responses or kind of releases around the President's plan and what community groups are saying about the strategy, and welcome anybody to share information that they've produced with us, and we'll post it on the blog. That's nationalaidstrategy.org.
And on that website also you can get the email address to write for more information. That's info@nationalaidstrategy.org.
All of us at AIDS.gov would like to thank Chris Collins and David Minar for speaking with us, and we hope to hear from all of our viewers soon. This has been a conversation with AIDS.gov.